Now, a few days ago, non-Nigerians and non-resident permit holder travelers from Brazil, India and Turkey were banned from entering the country due to the rapid increase in the number of COVID-19 cases in those countries. Meanwhile, all Nigerians or persons holding immigration passport to work or live in Lagos coming into Nigeria will follow the Federal Republic's mandatory measures by going under quarantine for 7 days, irrespective of their COVID-19 status. Nigeria has so far recorded over 100,000 cases and over 2,000 deaths. Details in this report.
Among the 14 countries Lagos authorities say they are keeping a close tab on are Canada, USA, France, Germany, Netherlands, South Africa and Angola. The others are Togo, Ghana, Cameroon, Uganda, Kenya, Tanzania and Rwanda. The state government says while traveling from these countries is allowed, travelers will be closely watched. The Nigerian government still maintains travel restrictions for India, Brazil and Turkey.
If you're coming from any of those three countries, either India, Brazil or Turkey, and you have a right to enter Nigeria by virtue of being a Nigerian or carrying immigration status that allows you to live and reside or work in Lagos, then you must comply with the federal government regulation, which is a mandatory 7-day isolation. From the airport, you will be escorted with professionals in a logistics team to one of those facilities where you will be isolated, and within the first 24 hours, we will perform your first COVID-19 test. Whether you're positive or negative, you will remain in isolation until day 7, where we will repeat the PCR test, and if you're negative, you'll be permitted to leave the isolation facility. If you are positive, you will remain in the isolation facility until you turn negative.
Health authorities in Lagos have managed to bring down the COVID-19 infection rate in the city. The number of severe cases has gone down significantly. Some isolation facilities have now been temporarily shut down for being empty, but authorities say the city is not out of the woods yet as far as the pandemic is concerned.
This is not a time to relax. This is a time to step up our activity and ensure that we are preventing the scenarios that could trigger a third wave. In terms of being able to curb or to prevent the third wave, we are carrying out this strategy alongst 5 pillars. The first pillar is to make sure that we keep our testing high so that we can pick up early any evidence of a third wave emerging in the community. In addition to that, if you are positive, we're going to repeat your test, this time with another type of PCR that can detect the possibility of mutations.
The government says it is also building more oxygen plants across the city, training more staff and putting more facilities in place in preparation for a possible outbreak of a third wave of the pandemic.
We're doing everything possible to make sure that we do not see a third wave, and in case we do, that we are able to contain it and bring it under control very quickly.
But COVID-19 vaccination is still very low in the city. With a population of over 20 million, just over 200,000 residents have been given the first jab of the Oxford AstraZeneca vaccine. There's just not enough vaccine to go around for now, and experts say that is a worry.